Nursing Assistant Army Exam Syllabus. Question 1. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: Option A. Document the temperature. Option B. Report it to the nurse immediately. Option C. Give the client a cold bath. Option D. Retake it in 1 hour. The correct answer is option B. Report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 2. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 3. Which task is outside the nurse aide's scope of practice? Option A. Applying a gait belt. Option B. Recording output. Option C. Changing a sterile dressing. Option D. Offering a bedpan. The correct answer is option C. Changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 4. When performing passive ROM exercises, the nurse aide should: Option A. Have the client perform the movement independently. Option B. Move the client's joint through its full range of motion. Option C. Force the joint beyond its range. Option D. Perform ROM exercises only once a week. The correct answer is option B. Move the client's joint through its full range of motion. Passive ROM involves the nurse aide moving the client's joint through its full, pain-free range of motion. The client does not participate actively. Forcing beyond the range can cause injury. Question 5. A client who is agitated and wandering should be: Option A. Restrained to ensure safety. Option B. Redirected calmly to a safe area. Option C. Left alone to tire out. Option D. Given medication to calm down. The correct answer is option B. Redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 6. In the event of a fire, the nurse aide's priority is to: Option A. Extinguish the fire. Option B. Rescue clients from the immediate danger area. Option C. Call the fire department. Option D. Save the client's belongings. The correct answer is option B. Rescue clients from the immediate danger area. The priority is to rescue clients in immediate danger. Race, rescue, alarm, contain, extinguish. Extinguishing the fire, calling the fire department, and saving belongings are secondary to client safety. Question 7. How should the nurse aide shave a client who takes blood thinners? Option A. With a straight razor. Option B. With an electric razor. Option C. With a safety razor. Option D. The same as any other client. The correct answer is option B. With an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 8. What should a nurse aide do if they experience a needle stick injury? Option A. Wash the area and report it immediately. Option B. Wait to see if symptoms develop. Option C. Apply pressure to the wound. Option D. Ignore it if no blood is visible. The correct answer is option A. Wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 9. A client is angry and yelling. The nurse aide should: Option A, yell back at the client. Option B, leave the room and return later. Option C, listen to the client's concerns and remain calm. Option D, call security. The correct answer is option C. Listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 10. A client with a history of COPD should have a target SpO2 of: Option A, 100%. Option B, 94 to 98%. Option C, 88 to 92%. Option D, 85 to 88%. The correct answer is option C, 88 to 92%. For clients with COPD and chronic hypercapnia, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia. The target for healthy clients is 94 to 98%. Question 11. A client at risk for pressure ulcers should be repositioned how often? Option A, every hour. Option B, every 2 hours. Option C, every 4 hours. Option D, once a shift. The correct answer is option B, every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 12. When providing care for a client from a different culture, the nurse aide should: Option A, follow standard procedures regardless of culture. Option B, ask the client about their preferences and respect them. Option C, assume cultural preferences based on the client's appearance. Option D, ask the nurse to provide care instead. The correct answer is option B, ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 13. What does the abbreviation ADL mean? Option A, ad lib. Option B, as doctor likes. Option C, activities of daily living. Option D, after daylight. The correct answer is option C, activities of daily living. ADL stands for activities of daily living, which include bathing, dressing, toileting, eating, and mobility. This is a fundamental concept in nurse aide practice. The other options are incorrect medical abbreviations. Question 14. The family of a dying client is upset. The nurse aide should: Option A, ask the family to leave. Option B, offer support and a private place to talk. Option C, ignore the family. Option D, tell the family everything will be fine. The correct answer is option B, offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 15. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 16. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 17. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B. Report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 18. The nurse aide should report which finding as a possible sign of abuse. Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A. Bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 19. When receiving a report at shift change, the nurse aide should: Option A, ask questions about unclear information. Option B, write down everything quickly and leave. Option C, ignore information about client preferences. Option D, rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 20. The pulse deficit refers to the difference between: Option A, apical and radial pulses. Option B, systolic and diastolic pressure. Option C, radial and carotid pulses. Option D, brachial and femoral pulses. The correct answer is option A, apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 21. When taking an axillary temperature, the nurse aide should leave the thermometer in place for: Option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 22. The nurse aide should document care: Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 23. A client expresses fear about an upcoming procedure. The nurse aide should: Option A, tell the client not to worry. Option B, acknowledge the fear and offer support. Option C, change the subject. Option D, tell the client the procedure is minor. The correct answer is option B, acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 24. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for seed difficile. Alcohol does not kill spores. Question 25. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters.